Welcome to the Joanne Avison podcast, and this is a week with myofascial magic in action, and it's my great pleasure to introduce Mr. Paul Thornley. Hello, Paul.
Hello, Joanne.
How you doing?
Very, very good. Been a busy week. Well, we're only, Tuesday now, but it's been busy.
I think time's doing some very strange things, Paul, but that's another story. So one of the questions that we've been asked in one of our live coaching calls on more than one occasion, it comes up a lot, is about plantar fasciitis. So just wanted to share a few things because obviously we've both had quite a bit of experience of this very painful, horrible condition, if you want to call it that. And really, I think it's named for where it is. So plantar meaning the foot and the fascia meaning the tissue. Generally speaking, I think people refer to it as the tissue that's under the skin, but it can be really unpleasant because it involves all the tissues, doesn't it? Really, the muscles and the ligaments and the tendons and the whole organization of the sole of the foot.
Yeah, it's a complete architecture of the foot, isn't it? Rather than one element of it. Once you get the itis, which is the irritation, the inflammation of that tissue, it can be incredibly debilitating. Like it can really ruin your day for many days, months, often years in some cases if you're not careful and you don't get the right advice at the right time to help you out of that particular predicament. But it's how you got into it, I think, is where the story lies. And that's the story you have to unravel, because that'll be how you find the solution to progressing through the plantar fasciitis and coming out the other end with as much relief as possible.
So one of the things that I've had in my experience, and please share what you've had in yours, is people think that plantar fasciitis is a condition, pain in the sole of the foot. Therefore, there is an answer to resolve it. And the condition has a resolution, whether it's cortisone injections or a particular type of treatment or whatever that is. Yep. And what I've found in my own experience is that pain in the sole of the foot can manifest equally for somebody who seems to have very high arches or somebody that has very flat feet. They can both be in pain. Mm-hmm. And of course, we know, and we'll talk about this, that those two things are for very different reasons. So you would treat them very differently. So just from your experience, Paul, can you elaborate on how that difference occurs?
Well, yes, it's from, of course, our genetics, epigenetic, and from development, isn't it? Like you aren't born with it. You are born with the architectural bias to having great architectural integrity, or you're not. And unfortunately, you don't often find out about it until you find out about it. Like you don't get the warning signs often, because remember, we talk about this when we ask how people learn to walk. Like you're not taught to walk, you learn yourself by self-exploration. And of course, depending on certain times in history, how do we promote activity of children? And what is a healthy developmental pattern and lifestyle, whether they used to have us in those bouncers, or you'd have them in those almost like a little mini boogie, which is you're sitting and you try to propel yourself around the room as you're learning to get your feet to work beneath you before you actually take weight bearing. And you're thrown into almost like a bungee jump of walking where some parent holds you up and then they offer you something to go and leap towards and see if you can catch your feet up as you go. And it's throughout those formative years and then going into our early childhood where we're toddlers and when we decide what type of shoes we're going to wear. And then remember, we are what we know. So our parents are doing it based on their parents before them and likewise. And some are a bit more proactive as they find out about what is a healthy option for this developmental of our structural integrity in our world. But for their world, it means, can my child develop and walk? Can they interact and go to school? Can I walk with them by my side? And of course, that then translates into later life. And of course, people like running or they don't. People have a bias to loving exercise over academia and vice versa. And it really is laid down in our foundations much earlier than we expect. But then all of a sudden, in our teenagers, in our early adult years, into our elderly years, then we suffer the consequences of how we laid down those early foundations.
I love that, because what you're basically saying, I think, is this predisposition is actually set down long before perhaps we realize. And I'm not going to make a case for either one, but maybe running around barefoot as children and playing. And we do have to be careful of that in the world we live in. I totally get it. You don't want children with cut feet or, injured from it. But at the same time, if, for example, they can run around in those little, we call them jellies, which are done up round their foot and their foot's free to move inside it. My experience is the foot has freedom to express within it. I think one of the horrors, especially when it happens young, are flip-flops and sliders and even trainers that totally enclose the foot.
Yep.
When a child's foot is still developing. We don't get that fantastic moving architecture. Coupled with that, you've got at the other end of the scale. I remember when I was a teenager I was doing promotion work, and you had to look glamorous. Think of an air stewardess, for example, and you've got to, wear the uniform, and it includes shoes with heels. Okay, how are we supposed to do that? And I think all of those factors feed in to, as well as the nature of our natural predisposition to a fallen arch or a high arch, those all come together. And then you get the special circumstances that create the pathology, right? Whether it's being a runner, I've had it, pregnant women very often, they've suddenly put on quite a lot of weight. Yes. And that's got to go somewhere. So that weight weighs down on the architecture of the foot. The foot opens and spreads. There's relaxin in the tissues, which allows the tissue to then overstretch. And we know stretching is not necessarily a good thing for the body. And plantar fasciitis in that case would be the result of over lengthened tissues, whereas wearing the high heels or wearing the flip-flops or the sliders all the time or Crocs would cause the foot to tighten in the middle. And it's actually a different quality of pain, I suspect, but who can tell? Both plantar fasciitis, right?
Exactly. And it's understanding that architectural texture that is going to define how they move, whether in or out of a shoe. And all too often, people are not aware of the consequences of ignoring the thing they hide in a shoe, in whatever type of shoe that happens to be. I have clients literally this week. It's the lovely season. Everybody's going out. Everybody's going to parties now. The weather's more forgiving and inviting to be outside in your much more fabulous attire. Paul, can you help me get into my high heels? No.
Sorry?
Paul, can you help me get into my high heels? No, because I'm not got one. I'm not a fashion consultant. But I can help you understand the consequences of wearing heels a lot, because it's going to change how you maneuver and walk and how you tolerate that containment of the foot in a really acute angle, which changes everything in the continuity of how you stand and move. And this is the thing, right? We become victims of our bias to our shoe because moving is inconvenient in the 21st century. Walking is something people do not want to do. We have access to too many eases of transport. So when we challenge our foot for any significant period of time, that's when we irritate the very sensory-rich architectural texture of the foot. And it goes, what are you asking me to do when you haven't prepared me to do it? You just want me to react and respond on demand, whereas I need more time to prepare, develop, and understand through the characteristics that I am so I can perform on your behalf.
Brilliant. Brilliantly said. And I think there's there's several avenues we can discuss here, and I think they can be really helpful. One of them is sometimes it's not because somebody doesn't walk, and it's not because somebody wants to wear high heels, right? I've had a question about someone's client who is a vet, and as a vet has to stand all day long, or, it doesn't have to be a vet to be standing all day long, but they could be in any job where they're standing all day long in the same shoes. And they're dealing with that hard surface interface of a floor, usually a cold floor. So, they don't want to be in anything slippery, and they don't want to be in a high heel, but nevertheless, they are standing 4 hours, different to walking again, I know. That's on the one hand. And the other hand is, and we'll cover both these things, I think, is that people say to me, oh, I've got plantar fasciitis and I'm really strong and I'm a runner. And I give them a golf flight ball to roll under their foot, for example, or a spiky ball or whatever ball. But I say to them, do not use a hard ball. Oh, no, 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 no. This is too lightweight for me. I need a hard ball. And they'll go and get a cricket ball or a rounders ball or a golf ball, and they'll push it into the plantar fascia. And I'm like wincing. And I think they're two different things. One is the surface interface. And one, of course, is that instant reaction to threat. And both are fascia, as the tissue of temporality in our body, having different responses because of the different timing. And this is where I think people get confused, that there is one cure and one condition, plantar fasciitis, roll a hard ball under your foot, or get an injection. And when we understand that there's actually that much more to it, there's a developmental element, there's this surface interface, there's this reaction time. So can you talk about the surface interface? Let's address, not the fashion queen or king, but the lovely vet that's got a footache. Well, bless them.
There are many arenas for you to irritate your body in. Very many. Whether you're active or you're a passive mover, whether you're a high performer or you're just a normal general Joe soap. But it's where you do it as a huge influence, because you're there for a prolonged period of time. So the golden rule is in the body is it needs to feel comfortable in the environment it is, and it will develop to be comfortable and thrive within that environment. So knowing about surfaces is very important, especially if people are in that position a lot for a long period of time, or they're active in an area of a consistent surface. So for instance, if you're on a hard surface, which is unyielding, there is no give in the surface, that's tarmac, or any sort of very firm surface that has very little bounce or give in it, then the bounce has to be within you, because you have to be able to force transmit the energy you deliver to the ground and receive from it efficiently and non-aggressively. So, of course, your body must compensate and adapt and change in that timely fashion to the surface you're inhabiting the most. So if it's very hard, the surface, you're likely to have very soft tissue and soft responding, we call them joints, we know them as virtual spaces, so they can deliver the energy of being there efficiently and not hard on hard, because that's aggressive. Something must give so that there is this natural bounce and recoil whilst being there. The reverse of that is a softer surface like grass or a running track, or this surface where there is the yield is in the ground. The ground is what's giving. And then you must become the harder surface so that you match that yielding surface with something more sturdy, that's more stiffness, a more appropriate constraint to receive that yielding surface and distribute that energy efficiently so you perform better. The problem is when you combine both. And we often see this just so that people are aware. They go, why is that person not performing as well as they should, or the way you perceive they should? When you have a track runner, somebody that runs on those lovely tracks in circles, or they're good at cross country, across grass and fields and the outdoors, and then they get asked to do the local marathon, like the London Marathon, and it's on tarmac and on paths and paving, and they don't perform the same way to the same quality. I mean, they're clearly an athlete. They can clearly do the distance on one surface, but their body responds negatively to the unfamiliar surface that they're now asking to perform on. And it takes a while for them to transition from track and field into road running so that they can become as competent. And this happens in daily life. We often work in offices where we're in flat surfaces, we're in our homes. My floor is whatever, is it marble or fake marble? It's bloody hard, the surface. But now I'm going to go to the gym and I'm going to put my nice soft trainers on. And now I'm going to go in there and I'm going to start doing jumping. I'm doing some skipping. I'm doing some boxercise. I'm doing a class. Or I'm going to go to my Pilates or yoga studio. I'm going to put on those ridiculous socks, those grip socks that look very pretty, but are pretty useless. And then I'm going to be in my bare feet on a spongy mat in Pilates and a grip mat in yoga. And I'm going to ask the foot to perform beautifully for me for that moment in time. But the vast majority of time, it's on the completely opposite surface. So it's like you're poking a bear and wondering why it gets angry when it was really comfortable in one environment, and you keep asking it to wake up and perform in another one that it's not ready for and not prepared to perform efficiently for any length of duration. And that is irritation of your tissue. But it's a continuity that has been broken, not just an isolated bit, because all of you is irritated. It just reveals itself in the foot.
Well, I remember being at a huge conference. I think it was in Canada. It might have been IFRC when it was, International Fascia Research Congress in Montreal. And I remember I was there with Dr. Wilbur Kelsick, as he's involved in the Canadian Olympic track and field team. And there was this enormous amount of kind of devotion, scientific papers, and so on, all about the value of barefoot running over, not barefoot, shod running, as they call it. And all the research showed, and this I think supports what you're saying, is that it doesn't actually make a difference if a runner is barefoot or shod in terms of running power and elite levels. Mm-hmm. What makes the difference is how they trained in their youth, working up towards their elite athletic status. Yes. Meaning, if they were taught unshod, I think Zola Budd was the first of those, wasn't she? If they were taught unshod, then putting them in shoes would cause them a problem. But if they were taught shod, teaching them barefoot would cause them a problem. So I'm not saying they couldn't transition. I'm not saying they couldn't change. But optimal performance wasn't about an outside reference. It was about the inside training, which I think supports what you're saying in the fascia's natural intelligence. It's a feedback system, isn't it?
Well, exactly. It is the fabric of who we are. So how we nurture it and nourish it and develop it early to where we want it to behave and excel matters. And how long we give it the time to be nurtured, to develop, to evolve into this amazing fabric that it can be, because we choose to run, or we choose to perform, or we choose to do a certain occupation that requires it to be vibrant and elastic and rebounding and have the resilience to be there frequently without consequences where it's damaged. And that takes time and awareness, and it takes refinement of use of you. And we tend to use too big a hammer on too small a nail. We want to beat ourselves to death to perform. And that's okay, because, of course, there is great success in torturing yourself to reach the heights of optimal performance. But if you're not refining the F1 car in the garage a lot, that one lap at the fastest possible time will not occur. And the human body is the same. Although we're not mechanical, we are the most highly tuned structure in the known universe. We are so complex. But we spend so little time in refining and understanding how it works optimally. We just expect it to perform optimally at much higher levels and much more macro events, where we really should focus on the micro and the micromanagement of those micro influences that help us restore, refine, and reorganize our optimal ability in all of our tissues. But particularly in the foot, because the foot is so highly sensory. Because in my world, I know the brain is here in the picture. I know that if we take over the cranium, we pop it out, it comes into your hand like a big ball of marshmallow. I've done it a million times. However, your brain doesn't touch the floor. Your foot certainly doesn't. And the first thing you're going to make contact with in the morning when you get out of bed is the ground with your feet. And it's how you make contact with your environment that stimulates your natural response to your day. It changes your mood, your emotion, your intention for how you're going to get up and how you're going to begin. Then it informs the brain, tells the brain how you feel and how you did it, and it stores it like a memory, and it reminds you how to do that subsequent days. But it's that really repetitive communication and that discussion and the dialogue you're having through your foot, rather than bypassing it and hoping your pelvis or your core or your brain takes over. And that is, you're just missing out a whole sequence of natural events.
Absolutely. And so as we kind of wrap this up, I think what we can conclude then, or in some ways explain why we treat every single plantar fasciitis condition as unique to the person that's experiencing it. They may be experiencing it for completely different reasons, so you can't use the same treatment. I know I've worked on athletes with shin splints, and they've come to me with, crural compartment syndrome, I think it's generally called. But we know that restoring the glide between those areas and reactivating the foot so that that kind of sweet proprioceptive wisdom is given back to the foot.
Yeah.
It takes time, but it can be done. But on the other hand, that treatment is the exact opposite of what you would do with a newly pregnant woman, or not necessarily newly pregnant, but, like 6, 7, 8 months in, who's in pain. No, different animal. We might even K-tape, bind that foot and help it strengthen, but always putting it in a certain type of shoe. And I think, however, what we can say is that within myofascial magic in action, we take this whole aspect of the internal spring loading it's one of the keys to what we're doing. And that then is more similar, isn't it? That internal intelligence, that internal spring loading is what we're training people to obtain.
It's the cornerstone of longevity of choice. You have to respect this tissue, because if you don't respect it, it can't help you do the thing you really enjoy doing. And it breaks my heart when I see people who love doing something so much and so often, whatever that happens to be, in a movement style, whether it's just for psychological benefit, mental health benefits, or physical prowess. But the very thing they like doing prevents them doing the very thing they like doing, because they overdo it. And your foot is king dingling. How your foot and your ankle perform and respond to performance, good, bad, or ugly, is reflected to how everything else responds to it.
Well, I'm quoting you. I know I am. And I just, I love this conversation because it gives us confidence that we don't always have the answer to the problem. What we actually have is a story and a mystery to solve. And then when we can unravel the components without accusing the client, but just simply uncovering the process that got them there, and then we can understand that architecture for them, we can then organize a protocol that works for them. And I'm quoting you when I say the talus is the crown jewel of the body, something we both believe, that it is somehow the victim of the rest of the foot architecture because you can't get to it directly.
Correct, yeah.
But if you can organize the rest, oh my goodness.
Well, that's why it's almost like when you see a drummer and they've got like so many drum options around them, and the feet and the hands are having to coordinate, and they create the most, it should just be noise, right? But it comes out something very rhythmical and really this great rhythmic beat that you can't help as the listener. You feel and resonate that individual beat that creates music in you. Or your foot is a set of drums. It's not always about whacking it really hard. It has to be rhythmical, as each part of your foot is finding its own way on the unpredictable surfaces we find ourselves on. And that's why we can't just have this linear planes of movement through the foot, when it is literally going to have to respond in every direction all of the time. And it's very important people, although when they look at the foot, whether it's a fallen arch or they have a high arch or whatever their naturally not deformed, the naturally developed deformation of the foot, if you like, has been created, it doesn't dictate how we use it. It might influence us against the way we'd like to use it, but it's always changeable. So don't accept the architecture that your arch falls. We understand and we respect that it is falling because of many reasons, and we'll work out what they are individually to you. But we're going to encourage, because we know the foot can that it will perform here. And it just changes our explanation and our conversation with each other that is then animated through your foot and then through the rest of your movement subsequently. Likewise, if it's a high arch, we don't have to be so stiff. It shouldn't be so immobilized. There is play there. There is yield. There is a way to spin something that is so restricted and constrained. However, we have to be subtle. So that's when we go back to those ball scenario where people like to poke a lot. Think of it like this. If somebody comes along and pokes you in your chest or in your eyeball, you defend yourself.
Too right.
And that's what people are so obsessed with this. It must hurt me for it to be beneficial. I must feel it for it to be having a positive effect. And sometimes that can be true. But in the large, the more subtle you are with your contact, and you invite the pressure to your body, and you offer an invitation, like you send an invitation to a party, your body will either invite it in and allow access, or it will repel it. I'd best start off subtle and softer and sneak your way into the party rather than gate crash your way into somebody's body, because ultimately it's likely to throw you out. And then it will reinforce the dysfunction rather than allow that positive change that you're really ultimately trying to achieve.
Beautifully said, Mr. Thornley. Thank you so, so much. And I hope that was useful. I know in MMIA, in some of our live coaching calls, we've had several questions about that. And I hope that summarizes some of the answers. And if any of that intrigues any of you and you want to find out more about MMIA and how we have these absolutely gorgeous sequences that will really help you work with any client with this condition, then please follow the links underneath the video or the podcast that you're listening to. And we look forward to chatting to you again soon.
Don't forget to subscribe, press the like button, and leave a comment.
Oh, we love it. We love that.
It creates more future conversations.
And also, if you've got ideas for podcasts that you'd like to know about fascia, about movement, about manual therapy, please, please, please feel free to make a comment below, and we'll be absolutely delighted to include it in our future schedule. Take care, God bless, and have a great day.
Bye, guys.